Hello, class. We're going to continue our lecture on basic trauma, and we are going to discuss emergency preparedness, mass casualty, and triage. Here are your objectives for part 3.
Emergencies include unexpected or sudden events that pose a threat to public health and safety. Examples of emergencies can include things such as a motor vehicle accident, a myocardial infarction, a cardiac arrest, a drowning. Usually, healthcare facilities are going to have adequate resources to deal with emergencies. And if they don't, they usually are going to have the capability to stabilize the patient until they can be moved to a higher level of care. Disasters are unexpected events that cause serious damage, destruction, injuries, and death. And mass casualty incidents are going to be a type of disaster, but it's going to be a catastrophic event that overwhelms local resources.
Emergency preparedness is a continuous and evolving process that allows us to better prepare for, respond to, and recover from emergencies and disasters that occur on a larger scale. Emergency preparedness allows us to develop more effective systems and processes in responding to emergencies, which will in turn take some of the burden off of the healthcare system. The first step of emergency preparedness is going to be mitigation. And mitigation is going to occur both before and after emergency occurs. In mitigation, potential hazards or emergencies are going to be identified, and steps are going to be taken to help prevent these emergencies from occurring. But sometimes, like with national disasters and terroristic attacks, you may not be able to prevent them from occurring. So in that situation, you will work on minimizing the effects of the emergency or disaster. In the Midwest, tornadoes are very prevalent. We have Tornado Alley. Mitigation would be installing a tornado warning system to notify the citizens that a tornado has touched down. And you could do that either before the tornado occurs because you anticipate that tornado is going to happen because tornadoes are prevalent in that area. Or it could also involve installing that tornado system, warning system, after the emergency occurred because you didn't have one previously and you learned from the mistake of not having one in place. The second phase is called preparedness, and that also takes place before an emergency occurs. Risk of an emergency or disaster are going to be assessed and plans are going to be developed to address those risks. The goal is to make plans to help reduce the burden that emergencies and disasters place on the entire healthcare system and on first responders, and to take steps to preserve human life. Now, preparedness is going to be done at a federal level, like with FEMA. It can be done at a regional level, at a state level, and at a local level. Next is going to be the response. And that is exactly what it says it is. In emergency response, nurses play a very critical role, as they do in the other steps. But here is where you may play a more active role. So knowing your system's emergency disaster plans is critical because you may be sitting at your computer charting 1 minute, drinking your Starbucks, and the next you're going to be at the center of a mass casualty and you need to know what to do. Nurses often play a role in triaging, in treatment, and in search and rescue options, and in helping in the recovery finding shelters for survivors, and helping the system go back to equilibrium.
Internal disasters are going to come within. So, this is going to be some type of disaster that occurs within the healthcare facility or the campus, and this can endanger the safety of the patients, staff, and or visitors, and you may need an evacuation or relocation plan. And this is often going to require extra personnel, and it's going to require activation of the facility's emergency preparedness response plan. Examples could include a fire, an explosion, a loss of critical utilities. That's why we should always use the red plugs at the hospital. Violence, if there's an active shooter, and things of that nature. And your priority is going to be to ensure the safety of the patients, staff, and visitors. External disasters are going to be any type of disaster that occurs outside of the healthcare facility or college campus. And this is going to require activation of that facility's emergency management plan or that emergency preparedness plan. Types of natural disasters may include things such as hurricanes, earthquakes, tsunamis, volcanoes, tornadoes, and some specific examples of natural disasters that have occurred in recent time can include Hurricane Harvey, which incapacitated parts of Texas in 2017, the COVID-19 pandemic, and the 2020 California wildfires. And external disasters can also include man made acts, such as mass shootings, acts of terrorism. Examples of that could include the Oklahoma City bombing, the mass shooting at the Pulse nightclub in Orlando, Florida.
So you're probably asking yourself, how does this affect me? It is important that you have an individual plan in place in preparation for an emergency because we know that these events can arise at any time. It is important to have an emergency kit, copies of important documents, cash, and don't forget to buy all the toilet paper. It is also important that you understand that as a nurse, you are going to play a significant role in emergency management. And so it is important that you become aware with your emergency operating plan of your facility or your state. And you need to make sure that you are familiar with ethics related to nursing responsibilities during a mass casualty event.
When preparing for emergency preparedness, it is important to consider how certain factors, such as age, and how certain patient populations may be at a higher vulnerability than others. For example, When working with infants and children, we need to consider that they may have some special considerations, such as they may not be able to walk, they may not be able to express their needs. Also, they may require specialty equipment such as diapers, formula, toys, and we also need to think about the emotional impact on children because this can be traumatizing for children. And with our older adults, we got to think about their heightened vulnerability as well. Many of them have chronic diseases with comorbidities. They may take certain medications. They may have cognitive impairment. They may need to take these daily medications in order to function properly. They may have home equipment such as oxygen, mobility equipment such as a cane or a walker.
Unfortunately, we live in a world where we have natural diseases such as Ebola, COVID-19, that are going to pose a risk to public health. But we also live in a world where we have to worry about people weaponizing certain microbes such as bacteria and viruses to spread chaos, fear, and lead to death. Because bioterrorism is a risk, it is important that you as the nurse be familiar with various bioterroristic agents, their modes of transmissions, signs and symptoms, preventions, and treatments. And one of the main things that are going to be put in place to help contain these microbes are going to be your safety zones. Your hot zone is going to be the most dangerous. PPE is required, and only basic life-saving measures are going to be done. Your warm zone, this area is going to be used for decontamination, rapid triage, and emergency stabilization. And your cold zone, that's going to be your area which is going to be utilized to provide support and provide medical treatment to stable patients. So what makes a good bioterrorism agent? This is going to be something that is going to consistently produce a given effect, such as disease or death, at low concentrations. The perfect bioterrorism agent is going to be highly contagious and have short and predictable incubation periods. And you may be familiar with some of the agents that are the most dangerous. And these are going to be those pathogens that are going to be easily transmissible and that are going to lead to significant disease, transmission, and death. The CDC actually has different categories, and it's important to definitely be familiar with your category A agents because those are going to be the ones that are likely going to be utilized in a form of bioterrorism. Things such as anthrax, botulism, the plague, smallpox, hemorrhagic fevers such as Ebola. Once upon a time, smallpox was one of the most devastating diseases known to man. In the 20th century alone, it killed over 300 million people. And luckily, through vaccination, it was officially eradicated in 1980. But because smallpox is such a contagious and debilitating disease, this is the perfect type of agent to be used as a bioterroristic agent. However, for smallpox, luckily there's a vaccine that can be given prophylactically or an immunoglobulin that can be given 3 days after exposure. And at least something is put in place to help protect you, because not all of the category A agents are going to have a preventative measure, such as the plague. If the plague is used as a bioterroristic agent, all we can do is treat the disease after it is in place. Anthrax, I do know, was being used, I think it was in the 90s, where it was being sent through the mail. And this was a very good agent to disrupt and cause chaos because it is highly contagious and it leads to significant disease and death. Luckily, there is a vaccine that is out there for those who are going to be at high risk. And after exposure, an antitoxin and antibiotics can be given for those who have inhaled anthrax. I am sure you're all familiar with how regular triage works. Triage is just a process that we use to identify patient needs and their level of care based on the severity of their illness and the number of resources that they are going to utilize. It works under the assumption that there's enough resources to treat everyone that presents, and we're going to use that ABC priority framework. You may not be familiar with reverse triage, and this is going to be the type of triage we use during a mass casualty event when the amount of resources we have are scarce. This type of triage is going to work under the model of doing the greatest amount of good for the greatest amount of people. Things such as age are not going to be a factor. For example, if there is a mass casualty event and there is a child that is likely not going to survive, it doesn't matter that they are a child. We are not going to utilize those resources. We are going to save those resources and use them for patients who are likely to survive. During reverse triage, a colored tagging system is going to be utilized to help us quickly identify and treat patients based on the severity of their illness and the likeliness of survivability. During mass casualty events, you are going to be faced with critical and difficult decisions that you must rapidly make. And this can lead to various moral dilemmas, but it's important to always work under the model of do the greatest amount of good for the greatest amount of people to ensure that the scarce resources are properly allocated. You have a duty to yourself and as well as others to work under this decision model and not with your heart. I know as a person, we always think about those vulnerable populations, but under this type of triaging, we have to do what's best for the greatest amount of people. During a mass casualty event, we are going to use a tagging system to ensure that we are making appropriate decisions and that we are appropriately allocating the resources. Patients are going to be tagged various colors depending on the severity of their injury and the amount of resources that they are going to utilize. A patient will be tagged black if they're unlikely to survive or if their injuries are incompatible with life. CPR is not going to be performed, and we are simply going to tag this group black and move on to the immediate group. And these patients are going to be tagged red. Our immediate group are going to be those who have life-threatening injuries but are likely to survive. This group will be tagged red when they need immediate treatment to help ensure stability and sustain life. After we see our most critical patients, we are going to move on to the delayed group. We will tag those yellow who have urgent conditions, but not immediately life-threatening conditions. Those that may have something like an unstable fracture would be tagged yellow. Although they have significant injury, it is unlikely that they are going to deteriorate in the next few hours. After we see our delayed group, we're going to move on to our minor group. These are going to be the patients that can walk and talk. They're very unlikely to deteriorate.
Here is the adult tagging algorithm, and this is what we use to triage patients. And this will kind of give you an idea of where the patient may lie. A lot of times it can be kind of hard to distinguish red and black, and sometimes it can be hard to distinguish some pretty significant yellows with reds. So if you kind of use an algorithm, it can kind of help you kind of work your way through it. So if a patient is tagged red, they need to be seen immediately. Things like chest wounds, shock, open fractures, second to third degree burns, as long as there's a survivability aspect to it. Same with your chest wounds and your shock. Now, delayed is going to be your stable abdominal wounds, your CNS injuries, as long as obviously they're not like an injury to your medulla, and you have fixed and dilated pupils, and you're not having spontaneous respirations. You are going to be black. You got to kind of it's not black and white. You got to kind of think through these things. And then your black is going to be your unresponsive patient, your spinal cords, and now your greens. They're going to be minimal. They will require some care, but you need to go save some people first. That could be your minor burns, minor fractures, some degree of bleeding. But yeah, if you're ever in doubt, kind of start looking at test questions with your algorithm, and then slowly start reviewing test questions without your algorithm and see how well you do on answering these.
Here is the Jumpstart Pediatric algorithm, and as you will see, it is going to be very similar to that of an adult. However, there are going to be some minor differences in some of the red versus black. And I want to see if you can identify these. Let me know. And this marks the end of part 3 of our lecture.